In this video, we are talking about Achilles tendonitis, what it is, how to fix it, and the importance of having the right diagnosis, because if you don't, you can make it much worse. Hi, I'm Dr. Clay Sankey, chiropractor and owner of TruMotion Therapy in Charlotte, where we specialize in the conservative treatment of musculoskeletal pain and injuries, Achilles tendonitis being one of them. Now let's start with the defining of terms. Your Achilles tendon is the largest tendon in the body, and it is responsible for a lot of that energy return that we get with running and jumping, which is why it is such a common injury in athletes. But anyone who spends time on their feet using their legs can develop Achilles tendonitis. And tendonitis simply refers to an overuse or a slow weakening of the tendon that results in pain. Tendinitis is an overuse injury. It's the result of doing too much too soon on a tendon that's simply not ready for the activity. So if someone is training for a marathon and they quickly up their mileage, or they're used to walking 1 mile a day and then they start walking 3 miles a day, or they join a new soccer rec league after having not played soccer before, they can develop these overuse injuries, and the Achilles tendon is a common culprit. So how do we fix Achilles tendonitis? Since it's an overuse injury, in the short term, we want a temporary reduction in activity. So if you're a runner, doesn't necessarily mean you need to stop running, but we might want to alter that schedule a little bit to allow things to calm down before we begin building things back up. In that short term, we'll also want to do some treatment on the muscles that surround the tendon to make sure they're moving well. If they're really tight, they're going to put excessive strain and stress on the tendon. Want to make sure that the joints are moving well also. So we'll do that with some hands-on work. Hands-on work on the muscles to loosen them up, and then some manipulation on the joints to get those moving well also. We also have some other therapies that we will apply directly to the tendon to help stimulate that healing process. And we're going to have a whole nother video on that. But some of those therapies include shockwave therapy, laser therapy, potentially some dry needling, simply to help speed up that healing process in the tendon. So make sure to check out that other video. Additionally, since Achilles tendonitis involves a gradual weakening or degeneration of the tendon, we want to make sure that we can strengthen it back up. So when you do get back to running or soccer or walking, whatever that may be, the tendon is strong enough to handle those activities. Now, it's not as simple as doing some basic heel raises. We need to match the exact type of exercise to your stage of Achilles tendonitis or your type of Achilles tendonitis. And we're going to have another video that focuses on the exercise portion of rehabbing Achilles tendonitis. So be sure to check that one out as well. And lastly, but arguably most importantly, we want to make sure we have the right diagnosis. Oftentimes people come in with pain around their Achilles tendon and they simply assume it's Achilles tendonitis, and usually it is, but many times it's not. There's a lot of mimickers out there. There are other tendons around the Achilles tendon that could be involved, and we're going to rehab those a little bit differently than we will the Achilles tendon. We also have bursa around the Achilles tendon. Now, bursa are little fluid-filled sacs that help reduce friction and irritation in the tissues, but sometimes those can become inflamed and be a source of pain, and we're gonna work on those differently than we will the Achilles tendon. We also have a tissue that surrounds the Achilles tendon called the paratendon, and that can become inflamed as well. And if you try to rehab Achilles paratendonitis the same way that you would rehab Achilles tendonitis, you can make it much worse. So it's really important to have the right diagnosis, and we go through diagnosing the proper source of your pain with diagnostic ultrasound. So that's something that makes our clinic unique, is that we use diagnostic ultrasound to make sure we have the exact right diagnosis so we can pair you with the right treatment so you can get better quicker. So not only are we going to combine world-class treatment like shockwave therapy, like exercise prescription, helping guide you into return to activity, but we are going to combine that with a world-class diagnosis as well. So if you're struggling with heel pain with Achilles tendonitis, we would be happy to help. Please visit us online at TruMotionTherapy.com to learn more or schedule an appointment.